A new report reveals that a company with an early contract to produce coronavirus vaccine doses hid evidence of problems. The New York Times is reporting that Emergent Biosolutions, the company hired to produce these vaccine doses, concealed quality control problems from FDA inspectors in February 2021, 6 weeks before it alerted federal officials that 15 million doses had been contaminated.
The report, which was released Tuesday by the House Committee on Oversight and Reform and the Select Subcommittee on the Coronavirus Crisis, sheds light on Emergent executives' own worries about deficiencies in the company's quality control systems at its Baltimore plant.
Now, according to the Times report, House Democrats said that nearly 400 million doses of coronavirus vaccine manufactured by Emergent had been destroyed due to poor quality control. Emergent disputes that claim that 400 million vaccine doses were rendered unusable and refutes the allegation that it knowingly misled the FDA. So, not good. I do want the FDA, if it's going to do anything, don't give me that look.
I was waiting what your take was going to be here, because the whole point here, the malpractice is that they were allegedly not disclosing failed vaccines to the FDA.
Well, who gets to produce the vaccines and what funding they get to do it is tightly monitored by the government. So they should make sure that the people that the government is entrusting to do this are actually doing a good job. And maybe this shows the bad judgment of the FDA getting swindled by these incompetent morons who wasted hundreds of millions of doses of vaccine.
So who in this scenario should be monitoring the quality of the drugs?
Well, the FDA.
Okay.
Yeah.
So we're here for it. We support the FDA in these limited contexts.
Limited context.
They should regulate vaccines, but not baby formula.
They should be more permissible about what people are allowed to take. They can say, here is what we think about this product. It's up to you. Instead of you can't consume this because we know better than you do.
So this vaccine is tainted, this baby formula is tainted, but you can still use it if you'd like.
Well, I would absolutely say that, and we have to consider. Again, I said this when I talked about it. We have to consider whether the harm is greater from not allow. Like, we have to look at the road not taken, the harm from not giving people swifter access to medicine, baby formula, etc. Even if we allow a slight harm of this was compromised or this is bad, we can't just ignore if there's might be a much greater harm of it taking, if it takes months longer for people to get vaccine or food, like, people will die because of that. But it's a little bit of like a
that's an interesting
trolley
point.
problem, a kill 6 people versus 2 people thing. But we do have to contemplate those things. The delays, the inaction, like, that has a cost. It's not just, it just takes us more time to make sure everything's safe and fine. But waiting longer hurts people too.
Yeah, so to that point, what do you make of the fact that, it's easy to forget about now that we're, a year into having vaccines, but a year plus ago, we were in a world where there were much bigger risks to getting COVID. Right. The vaccines really cut into mortality, although we have recently hit the, million death mark, which is pretty significant and galling, given how few people comparatively die each year from something like the regular flu. There was a lot of pressure back in the spring of 2021, especially on the Biden administration, who had campaigned on, ending COVID and meaningfully behaving differently than Donald Trump would in the situation, to get COVID vaccines out to the public. Mm-hmm. And I think there was a cost benefit that was being decided at the time, who knows rightly or wrongly, about how quickly to push vaccines out versus how long to wait and study their effects, while in the interim, there was a cost in terms of people's lives who were dying from not being vaccinated.
It made me furious at the time when, there were so many doses of the AstraZeneca vaccine sitting in warehouses in the United States, not being used. We weren't using them. We actually had no plan to use them. Well, put them on a ship to Brazil then. Somebody should have access to these. And even if, they say we have to do so much testing, we have to do so much. Sure, but think of a 95-year-old person at that stage for the original infection, maybe Delta 2. Now we're dealing with more mild strains, but a person in their 90s who got COVID a 2 years ago, it was going to be bad for them. Mm-hmm. They had a much greater mortality risk. So you have to weigh that against, well, we haven't decided that this vaccine's completely safe, but getting the disease is really not safe for them. Mm-hmm. So is there any, contemplation about that kind of thing?
No, but I'm saying I agree with you. I think it's a difficult decision that people have to make, that governments have to make. But it does seem to me that there's a parallel between saying, we're going to push maybe COVID vaccines without perhaps, as much testing. You want us to get COVID vaccines out the door.
I want to let people make their choice. I want to let people decide, not the government. I want to let people decide. The government can tell people what it thinks is best practices and what it thinks is best science. They're welcome to weigh in on that. But unfortunately, and the CDC is frankly worse, has become the default policymaker on all, not just for vaccines, but for masks, for social distancing, remember what I saw someone tweet a photo the other day of the stupid. Can you believe we were walking through like grocery store aisles, like this is an aisle you only walk this way in, this is an aisle you only walk this way in? And that was coming from the CDC. It's just ridiculous. It's just so stupid. But everybody did, and they do technically have just recommendations powers, not actually. They have some enforcement power. But we defaulted to they just became de facto enforcers. That is not something I want.
Yeah, I mean, there was stuff that was obviously silly and wrong. There was stuff that was COVID theater. And then there was advice that I think was good that continues not to be taken, like the efficacy of higher quality masks, which was downplayed early in the pandemic.
By the CDC?
By the CDC.
They said any mask, just get a mask, any mask.
And what confuses me about some of this COVID discourse that we have is that there's all of this frustration about the idea of the government lying to us. Mm-hmm. And the generalized reaction is to say, well, I don't want to do anything. I don't want to adopt any COVID protections because the government has lied to us about it. But some of the valence of the government's lies has been lying about the efficacy of some of the protections. It's gone both ways. And it's interesting to me that the frustration with the government and the misrepresentation hasn't caused the bulk of, I think, whether you want to call them COVID skeptics, that's not the right word, but people who are distrustful, it hasn't caused them to say, the government lied to me that these things would protect me and it's keeping them from themselves. Therefore, I'm going to adopt more of these policies. I'm going to stock up on the high quality masks. I'm going to distrust that the Biden campaign is telling everybody to go back to work after 5 days, even if they're still testing positive. I'm going to distrust all of that because obviously their interests are aligned with big business and keeping the economy going, which obviously has some benefit to us as well. But their interests aren't really our individual health and safety. That doesn't seem to be the reaction to the government lying to us in all of these multiplicity of directions about COVID.
I mean, I would say it should be. Right. We shouldn't just ignore the times. Right, I agree. They've lied in both directions, and that should make us put more onus on the individual to decide what is the right, in consultation with your doctors or whatever experts you think are knowledgeable. Maybe consider what other health guy, official other country. The authorities in Europe did not recommend nearly as intense masking of school children as we did in the U.S. All these comparisons to why can't we be more like Europe, like totally collapsed on the masking in schools front. But so I think people should, if people want to choose because people are different, a healthy 20 or 30-year-old. It makes sense to have a vastly different risk threshold than an unhealthy or overweight person of the same age or of a person in their 50s or certainly 60s, 70s, 80s. That makes total sense. And people should use their best judgment, and they should listen to the health officials, and they should listen to their doctors, and that should be that.
And the same logic should extend to abortion rights.
Okay, it should. So we. Well, I have said I have a range of views on that issue. I hear that argument. I think that argument would have been more compelling, as I've said, if progressives, liberals, Team Blue didn't actually. I mean, no, health decisions are made by the CDC.
I don't know that it's fair to conflate what Team Blue or Anthony Fauci says with what millions of women across the country whose beliefs like mine are entirely consistent on these issues as being against mandates.
The COVID stuff wasn't really put to
against abortion restrictions.
Abortion is now going to be, if Roe v. Wade goes the way we expect, it's going to be voted on by. It's going to be decided by state legislatures. So much of this bad COVID stuff I'm complaining about was administered by bureaucrats without any accountability, anything having to do with the elections process. Yeah, let's put it to a vote. Let's see how many people in which states actually want to mass toddlers forever. I'd be willing to have that vote.
If they want to say that there's a constitutional right to privacy to keep you from having to wear a mask, I am open to that argument, but I am more committed to the idea that there's a constitutionally established right to privacy and bodily freedom that has gotten us gay marriage rights, contraceptive rights, and racial marriage rights.
If this so-called constitutional right to privacy had protected those of us who didn't want to follow all of the insane COVID norms, I'd probably be more enthusiastic about the whole idea right now.
It seems like we might have come to a compromise position here.
All right, a quick programming note. If you are missing Kim Iverson, our dear friend today, we are too. She tested positive for COVID and she's feeling just fine, but will be taking a few days to rest. So please send her your well wishes and we will do so as well. Now, tomorrow on Rising, candidate for New York Lieutenant Governor Anna Maria Archila joins us to discuss the vote to protect Roe v. Wade and next steps for the Democratic Party.
Be sure to like, share, and subscribe so you never miss any content. And while you're at it, subscribe to the Hill's Just In channel for more original content and coverage of developing news throughout the day.
And for those of you who like to listen while on the go, we are now available anywhere you listen to podcasts. So listen there, and we will see you all tomorrow. Thanks for joining.
Bye-bye.